Welcome to running your first diagnostic color vision test with the Waggoner Computerized Color Vision Test by Waggoner Diagnostics. For today's demonstration, we are going to be taking the Adult Diagnostic. The Adult Diagnostic test consists of 5 sections. The General section, which consists of 1 demo plate and 25 pseudo-isochromatic plates that screen for protan and deutan color vision deficiencies. This section is both randomized and adaptive and will end immediately upon the individual missing the maximum allowed. Section 2, the Tritan section, consists of 12 desaturated plates that test for both genetic and acquired deficiencies. The 2 sections I just mentioned are always given during any diagnostic test. If the individual taking the test fails the general section, sections 3 and 4 will be given. Section 3 is the Protan section. It consists of 32 desaturated plates that quantify the protan or red deficiencies. Section 4, the deutan section, consists of 32 desaturated plates that quantify the deutan or green deficiencies. The protan and deutan sections are also adaptive. Since we used a desaturation method to quantify the deficiency, after the individual misses 5 plates in a row, we move on. After the above is completed, a pop-up appears asking if the individual should take the D15. In clinical studies, the D15 has shown to be an inferior test in both sensitivity and specificity, in comparison to the Waggoner CCVT. However, it is complementary to our test and helps with reimbursement purposes. Let's begin. Simply select the arrow on the right-hand side of the screen. Select New Patient from the screen that just appeared. The next screen appears where all the patient information will be entered. Please note, test condition will be added to the results page to let reviewers know that there may have been glare on the screen that interfered with the test results. You can also decide whether you want an individual to take the test binocularly or monocularly. If monocularly is chosen, you can choose both OD and OS, or just one. For this test, we will be testing both eyes. Select the arrow to move forward. This is the instructions page. At this point, we recommend that you allow the patient to read the instructions on their own. This standardizes the testing procedure and removes administrator bias during the testing process. Select the arrow to continue. This is the last screen prior to the test beginning. It simply informs the patient which eye or eyes to use during the test. So let's begin. The patient will receive a 3, 2, 1 countdown before receiving the demo plate. The user simply uses a keyboard to enter the information or selects the numbers from the on-screen number pad. The plate only shows for 3 seconds, but the patient then has 10 seconds to input the answer. Select the arrow to see the next plate. This process continues for all sections until the D15 pop-up. You will notice that in the upper right-hand corner of the D15 pop-up, it has a N or D. The N stands for normal color vision and the D for deficient, as in color vision deficient. Select No if you do not want the patient to take the D15, and select Yes if you do. For today's demonstration, I will take the D15. Here you can see the D15 instructions. Please select the arrow to begin. There are 2 ways to add the colored chips to the horseshoe. 1, you can drag and drop, or 2, you can double tap. Either way works. An individual can also place a colored chip into a location where one has already been placed, and it will simply move the others over. Once the patient is complete, please select the arrow on the right-hand side. This is the diagnosis page. This is where you will select the diagnosis for your patient. For this test, you can see that I'm a severe deutan, so I've selected deutan defect under the genetic column. You can also pick from any of the other diagnoses listed on the page or add your own at the bottom. By selecting the diagnosis, it helps give you the proper ICD information for reimbursement on the results page. Last, we have the results page. Here, you can see all of the patient and testing information is at the top. We have the score for each section over here, the calculated result of the Waggoner CCVT here, and the diagnosis that you have chosen here. As you can see, my calculated result was severe deutan, and I've selected that from the diagnosis page. Now, it's your turn. Go run your first diagnostic test. Thank you for using the most cutting-edge technology in color vision diagnostics and making a positive difference in your patients' lives. If you haven't downloaded and installed your free trial yet, there's no better time than the present. Go to www.waggonerdiagnostics.com to download your free trial of the Waggoner Computerized Color Vision Test today.